Hi everybody, it's Jennifer. I have not made a video in a very long time. I hope the video quality is okay. I have a new computer now and my camera looks huge, which was not beneficial to me because I don't have any makeup on. And I didn't think it would matter because I thought my camera was smaller, my picture was smaller. But at any rate, so I haven't been here in a while. I think a lot of that is just due to the fact that I'm 5.5 years gastric bypass post-op. I'm 2 years, almost to the day, 2 years tummy tuck and arm lift post-op. And you just kind of get into a sense of normalcy, and you don't really feel like making a video when you feel like you're going to bore people, because I'm no longer concerned with food choices. I'm no longer concerned with weight gain or weight loss. I'm no longer concerned about scars or healing. Everything has kind of just settled into normal life, and I eat what I want to eat. I don't count my calories anymore. My weight ranges between 185 and 200. Sometimes it'll go slightly above 200, but it always goes back down. I really do think that having the tummy tuck and the arm lift does make a difference in your ability to regain weight, because I don't think it's as easy to regain weight after you have the tummy tuck and arm lift. And I'm going to say that has to do with the removal of fat cells. But it's just a theory. I have no idea what I'm talking about. So, but anyway, I thought excuse me. But I just thought I would come out and make a video because I haven't been here in a while. And I kind of have big news. Excuse the blanket. But I am constantly exhausted and extremely cold all the time. But I'm told that both of these things are very normal during your first trimester. And I am pregnant. I am 7 weeks and, hold on. 7 weeks and 3 days. I've known since, I kind of suspected around week 3. I took 4 pregnancy tests. The first 3 came back negative, and then I missed my period on a Friday, and Saturday morning I took the test and it came back positive. And I have wanted this forever. My last 2 pregnancies happened in 2001. I obviously don't have any children, so they did not go well. And I haven't been pregnant since. And since then, I have gained a tremendous amount of weight. And I think I got up, I know I got to 323 was the last time I weighed myself at my heaviest. So I know that I was heavier than that, though. And then you have the gastric bypass, and I had the revision, and then I had my tummy tuck and arm lift, and it's been 5.5 years since I started that journey. And I will tell you, the interesting thing about pregnancy after bypass and after the tummy tuck is I am losing weight. I don't have morning sickness, and I don't know if that's because our stomachs don't really hold like all the acid and all of that stuff that most normal people have in their stomach. I don't know that that's it, though. I think I'm just one of those really lucky people that, like, knock on wood, don't have morning sickness. I'm told that the tummy tuck would be completely fine, that my stomach will still stretch how it needs to stretch, and that after the baby's born, I will still be happy with my results. Which, honestly, I've wanted a kid for so long that even if the results end up to where I have a little bit of saggy skin, I don't care. I really don't care. But I'm told it might take a little longer for me to show because the muscles, the tummy muscles were tightened during surgery, so that it's harder for pregnancy to show, that it might take you longer. However, this being my 3rd pregnancy, each pregnancy you start to show a little bit sooner. So even though my first 2 pregnancies did not result in a healthy baby, this is technically my 3rd time being pregnant. And so I'm 7 weeks now. I don't think I'm showing, obviously, yet, but I do feel like my, lower abdomen is stretching a bit, and I can tell, I can tell I'm pregnant. Today especially, I even told Noah, like, I'm definitely pregnant today. um, but like I said, I'm really tired all the time. I'm excessively cold. I'm not quite, I have a hard time staying warm in the winter anyway. This kid is not making it any easier at all. And my doctor says that sometimes, your baby furnace is what she calls it. It's so busy it's heating you up, but your body's working overtime to cool you down. And sometimes it kind of like goes into overdrive and makes you too cold. So that's kind of what I'm dealing with. And I've been dealing with it for about 3 weeks. I got a really bad sinus situation going on. And I think it got mixed in with a cold because there was a virus going around at work. So those two things combined with the fact that I also have asthma, and I've had 2 sinus surgeries in my life because sinuses are a big problem in my family. It's hereditary. So I've been dealing with that, and I have this cough that I hope I don't go into a coughing fit here on the camera. But besides that, it's been a pretty easy pregnancy so far, but it's only been 7 weeks and 3 days. I'm interested in seeing how my bypass and how my tummy tuck play a role in the pregnancy. My doctor, I already have seen a doctor because I'm high risk because of the past pregnancies ending before they should have. I have PCOS. I am 38 years old. So I have plenty in the gastric bypass. So I have plenty of factors working against me. So I have already seen the doctor. The doctor said the one thing that they are always concerned about in their gastric bypass patients is A, that they're not going to gain enough weight, and B, that they're going to have vitamin deficiencies. Obviously, we're bypass patients. We don't absorb nutrients and all of that good stuff. We don't absorb that stuff very well anyway. I have been on a prenatal pill for a year prior to being pregnant because I was wanting to be pregnant eventually, and my vitamin levels were so low that they just said, well, just go on a prenatal pill. So now that I'm pregnant, I'm taking 2 prenatal pills. I take one in the morning and one at night. Still no morning sickness. I know a lot of times that the prenatal pills will make some women really, really sick. But for me, I haven't really had that effect. I am at the stage where I don't really feel like eating much, but the past couple days my appetite has increased. I was doing pretty good about not drinking as much caffeine and reducing my sugar intake and eating more like apples and bananas and salads. I have a V8 fusion every morning, which doesn't sound like a big deal to a lot of people, but I have grown up my whole life not eating fruits and vegetables. And even after my bypass, I did not change the way I ate. Really. I mean, I eat protein first. I always make sure that I get my protein in. I get at least 60 grams a day. But I never really stopped eating the sugar or the carbs. And I still don't. And I still lost 140 pounds. So, I think it's just a matter of everybody's body is different and everybody reacts differently to surgery, and that's kind of my story. But now that I'm pregnant, it's way more important to me that I am nutritionally, I don't want to say nutritionally sound, but better. Noah is driving himself crazy because he eats better than I do. Everybody in the world eats better than I do. And it drives him insane that he wants me to have a more balanced diet for the baby and for myself because he's concerned for my health as well. And it drives him insane that he knows he can't tell me what to eat. And he knows he can't tell me what not to eat. And we're reading, baby books, and it's his first, and well, hopefully my first, and live, healthy baby. And the first time that, you know, I don't know, it's just a lot of firsts. So we're reading books, and I have several apps on my phone, and I'm looking up stuff online, and I'm calling my doctor's office, and I'm just trying to do everything as right as I can. But I keep trying to impress on him the fact that there are women who eat horribly during the pregnancy. My sister did not know she was pregnant till she was 7.5 months. And that entire time she was downing Red Bulls and eating nothing but sugar and fast food. And my niece is beautiful and healthy, and she had a normal pregnancy. So I just keep trying to tell him, like, as much as we want to do the right thing, and as much as I have changed some things, I still have to feel like me, especially now when there's so many times I just don't feel like eating. So whatever I can get myself to eat so that I'm eating at least 1,000 calories. My doctor wants me eating 2,000 calories, which, I mean, literally the only way I can do that is if I eat a bunch of crap. I just don't feel like eating, and when I do feel like eating, I can only eat so much. So it'll be interesting to see how the bypass factors into all of this. And then the tummy tuck, I'm actually like really, really happy that I had it before I got pregnant, because it is like always been, like, I've always wanted to be able to show when I'm pregnant. I didn't want to just be like fat and then I'm pregnant and nobody knows that I'm pregnant because I'm just fat. And now people will know. And I already had somebody at work like touch my tummy, and like normally that would have freaked me out, and it doesn't freak me out now because my stomach is flat. I mean, it's flat. It's for the most part flat. And I would show you, but I have a nightgown on, and if I show you, I'm gonna flash everybody. So, but it doesn't bother me at all. And so I'm really, really happy that I'm going to look pregnant. And I know that's weird to some people, but it's very, very cool to me. Oh, I'm also an emotional person anyway, but pregnancy has made me more emotional. But besides all that, that's it. I'm pregnant. I also have a new job, and Noah, who moved out last year at this time, and we really didn't even know if we were going to stay friends. We have known each other for 23 years, and so after he moved out and the dust kind of settled and we kind of let emotions die down, starting in like December or January, we started talking a little bit more often on the phone. And then we started doing a lot of couples worksheets. And we weren't doing it with the intention of getting back together. We were doing it with the intention of healing our friendship and being able to maintain our friendship by getting to know each other for who we are now. Because I think we got into a rut where we were pigeonholing each other into who we thought the other person was as opposed to who we actually are. So we did a lot of those kind of things. We did a lot of listening. We made a lot of different rules about communication, which has been so instrumental in us being able to get along much better. And then just progressively through time, we ended up getting back together. And then I told him like I wanted to have a kid, and he's known that I've always wanted to have a kid. So he agreed that we could start trying, and we weren't trying like every time, but we were obviously trying enough. So he was kind of shocked that it happened so soon because we've only really been trying since July. And I was surprised too, because with PCOS, and I was just really like surprised that it happened this soon, but it did, and everything seems to be going well. My first my first like ultrasound appointment is November 10th, and I will be 1 day shy of 9 weeks. So that should be a very good ultrasound, and I'm going to bawl like a baby. I know I already knows this, so I think he's gonna probably be pretty emotional too. So it's crazy how life works out. He hasn't moved back in yet. I enjoy my solitude. He is here a lot. But just not ready yet. I keep joking with him that I want him to like buy a house next door so that I could still live alone and he could still be like right there. Because I think I'm just much better living on my own. But like I said, he's here all the time, and I do sleep better when he's here, and it's nice. It's nice, which is weird because I never thought a year ago I'd be saying that. But there you go. So that's my update. I'm gonna try to make videos more often now that I actually have something new to talk about, and I will have new experiences that will factor into my weight loss surgery path and my plastic surgery path. If you have had surgery and then you've gotten pregnant, your input and your advice and your words of wisdom would be so very welcome. There's only so much that you can learn online, and I know that YouTube is part of an online social community, but first-hand accounts are very helpful, and I'm wise enough to know that just because you had the experience doesn't mean that I'm going to have that experience, but it's nice to know what to possibly expect. So there you go. I guess that will be it. I was gonna say that the year memorial of Doug's passing was October 17th, and he was on the YouTube community. He knew a lot of people here. I still wear the necklace that he gave me when we were dating, and I'm glad that Noah's mature enough that he understands what it means to me to wear the necklace. But yeah, just wanted to mention that. So, bars are crying. Thank you all for watching, and I will update again soon. And again, comments are welcome. So have a wonderful, well, happy Halloween, and have a wonderful season, and I will talk to you soon. Bye.